have a desire to treat versus not treat. So talk
Yeah.
about that for a little bit, especially as an orthopedic surgeon. Someone comes to you, they're in extreme pain, you know, making that
Yeah.
decision, okay, we're going to treat it without surgery.
This is very powerful. The incentives in the health system drive interventions. Patients want to be treated. Patients' friends and relatives want them to be treated because they just want to be seen to be helping them and doing something. And they're going, you should get that operation done. You know, you've been complaining about this for ages. You know, just go ahead and get it done. The surgeon doesn't want to feel incapable or incompetent or not able to help. So they're kind of like, well, yeah, what the hell, let's just do it, because I think it'd be great if you got better and I did that operation. Everyone will be happy, everyone wins, the hospital wants the surgeon to do it because that's how the hospital makes money. The whole system, even the insurance companies who don't like to pay out for things, live on turnover. The insurance companies just live on turnover. Okay, if we do more operations, we raise premiums. That's just a mathematical thing. So the whole business, the reusables, the device industry, everything lives on turnover. But it's very difficult. And I have these arguments with surgeons about arthroscopy, and it's funny the things they come up with. When I say to them, the operation doesn't work, and they say to me, well, if arthroscopy doesn't work, what are we supposed to do? We'll just be doing knee replacements on everyone instead of an arthroscopy. and I'm kind of like, no, you can not do an operation. And they're kind of like, oh yeah, I guess, okay, I didn't think of that, I just did a seminar in South Korea by video conference that ended up. And it was on this thing about, arthroscopy, because apparently South Korea has one of the highest rates of knee arthroscopy in the world. It's higher than America. It's just off the charts. And I didn't know this. And so they did this television program and they interviewed me, and they're saying, and they interviewed some high-level orthopedic surgeons in South Korea. And they said, yes, but, we know the evidence shows that it isn't effective. But what if the patient's in a lot of pain? Yeah. And I said that doesn't make the operation effective. And they kept raising this point. And it's the same argument I get. One of the first talks I gave, I remember I was really scared when I gave this talk. This is years ago, and I gave a talk to an Australian Orthopedic Association, big meeting with all the surgeons there, and I was a lot younger. And I got up and said, I don't think this operation works. Here's the evidence. We're doing this a lot where it just doesn't work, for arthritis. And this elder surgeon got up, and I found out later he was the president of the Knee Society. He was like a big name. And he looked very smug, and he looked around at all his friends in the audience, and he said, you say that surgery is not better than non-operative treatment, and they should have non-operative treatment. But what you fail to realize is that these patients have already failed non-operative treatment, and therefore they should have operative treatment. And on the surface, that's a very appealing kind of bit of rhetoric, isn't it? It's kind of like, well, they've failed non-operative treatment, so I guess they need operative treatment. It's very hard to argue with that. But then I thought, well, hang on a minute. I said, no. I said, we have an operation that is not effective. The fact that other treatments haven't been effective either
doesn't make this one right.
It still is not effective, So yeah.